Hi, hello everyone. Welcome to Agni Nursing Academy. I am Prakash Kulki. Wishing you a happy Diwali to everyone. May this festival of light gives you a light of success and happiness to you and your family. Then let us move on to the first question. Waste contaminated with blood and body fluids like dressing, plaster cast, cotton swabs should be discarded in. Here the first question is on the biomedical waste management, BMW. In BMW, how much color codings are there? Basically, four colors. That one, red, yellow, blue, and white. These are our basic color codings. And green or black, that one general waste. So here in red color, we have to discard the plastic bottles. Okay, plastic bottles like IV sets, IV set, IV bottles, rails tube, like rubber things also you can discard in the red color. Then coming to the blue one, in yellow I will discuss in detail according to the question. Okay, blue, we have to discard the glass waste means ampoules, then vials, then one more important, metallic body implants, metallic body implants. Make it as a question. Okay, this is important. Metallic body implants we have to discard in the blue color bins. Then coming to the white means we have to discard the metal sharps, that one, metal sharps like needles and blades means scalpels. Okay, then move on to the yellow color. This yellow color waste management very important. Every other exam they will ask in the examinations on the yellow color coding, how to discard, what all are the things we have to discard in the yellow color bins. Then what is the method of disposal, what all are the treatment methods in the waste management. That one I am going to discuss here. First one, what are the things we will discuss. First one, this yellow color considered as the most infectious waste. Yellow color waste is considered as the most infectious waste in the BMW. Then what are the waste we will discard in the yellow color coding? First one, human anatomical waste. Human anatomical waste. Second one, animal anatomical waste. In human anatomical waste, it may be the placenta. Previously, I already asked placenta and amputated body parts, amputated parts. Then one here anatomical animal anatomical waste means lab samples like lab animals, for experimental animals. Okay, experimental animal wastes we can call it as animal anatomical waste. Then coming to the next one, discarded medicines and expired medicine we have to discard in the yellow color. Okay, discarded medicines are expired one. Expired one. And one more important, cytotoxic drugs. Cytotoxic drugs. And next one, which one we have to discard in the yellow? Soiled waste. Soiled waste. Then next one, chemical waste. Okay, then coming to the what all are the methods to treat the this yellow color waste. Methods of treatment or disposal. Then here, human anatomical waste, what we have to do? We have to incinerate we have to burn the waste. Incineration or deep burial. We have to dug the land up to 2 meters and after that we have to put the waste and we have to close the tip. Okay, deep burial. Before this placenta and animal parts, we have to pre-treat with the 2% sodium hypochlorite solution. Okay, 2% sodium hypochlorite solution we have to pre-treat. After that we have to debury or incineration. These both are same, human anatomical waste and animal anatomical waste. Then coming to the uh, discarded medicine and expired drugs. So these we have to discard through the incineration. Incineration is the best way to discard these discarded medicines and expired drugs. Then here cytotoxic drugs, we have to separately burn these separately, like we have to label it as a cytotoxic. While transporting in hospital, we have to collect the cytotoxic drugs in the separate bag which is labeled as a cytotoxic, and after that we have to incinerate this one. Then soil waste, what all are the soil waste will come in the soil waste? That cotton swab and dressing, plaster cast, these are we have to incinerate, or we have to incinerate this one. Okay, otherwise plasma paralysis is there. Plasma paralysis, I will differentiate the plasma paralysis and incineration. In incineration there is a burning process is there with the O2. With O2 we have to burn the whole waste. In plasma paralysis we have to burn the waste without O2. Okay, without O2 we have to burn the waste, that one called as plasma paralysis. Then one more, chemical waste. Chemical waste means disinfectants and like a spirit expired chemicals we have to pre-treat with a pre-treatment, and after that we have to discharge. Chemical treatment is there, after that we have to discharge the chemical waste. So this is your yellow color waste management. Then coming to the question is, here they are asked waste contaminated with body blood fluids like dressing, plaster cast, cotton swab, we have to discard in the yellow color. Okay, yellow color bag, the option B is the correct answer. Okay, option B is the correct answer. Then move on to the next question, that is, which of the following is not risk factor of pressure ulcer? See, this is the question on pressure ulcer. What is this pressure ulcer? Why it happens? Pressure ulcer. See, pressure ulcer caused by the prolonged compromised blood circulation to the particular tissue which is prominent to our body, where we have to rest on this. Okay, here pressure ulcer because of compromised blood circulation and delayed wound healing also can happen. Here some are the risk factors are there. Risk factors are there that may cause pressure ulcer. That's one for, let us discuss one by one. First one is immobility. How immobility can cause the pressure ulcer? See, if a patient is in continuous bedridden in ICU, or a patient paralyzed or spinal surgery, that may cause the pressure ulcer because of continuous pressure on the bony prominent tissues, where paralyzed patient and surgery patient, ICU bedridden patient. Then coming to the next one, age. If the patient is older patient, their skin have less elasticity. The patient don't have less not that much elasticity to the their skin, and there is a not proper blood supply. Okay, blood supply also reduced. Blood supply by older age, in older age patients, there is compromised circulation to the skin also. Okay, their skin become thin also. Okay, thin, it is become very thin, so it can cause easily damage. Okay, it can then move on to the next risk factor, That one, incontinence. So if the patient continuously unknowingly patient is passing the stool or urine, the patient don't know when he passed. Now the patient cloths become wet. That wet leads to skin become moist and macerated. Patient skin become moist and macerated. That can cause easily breakdown or moist and leads to infection also. Okay, if the skin become moist and macerated, it's easily get infection and breakdown. Okay, this is also the risk factor of pressure ulcer. Then move on to the next one, poor nutrition. How poor nutrition can cause a pressure ulcer? If the patient not getting the protein, vitamin C, zinc and iron, so these all components very important to tissue repair. If patient not getting these main important minerals, tissue repair can't happen easily. Delayed wounds, delaying in delaying in wound healing. Okay, next one, low BP. If the patient having the low BP, hypotension, that blood circulation become compromised. That one, poor perfusion. If the patient not getting proper blood perfusion, there is no supply to the O2 to the tissue, and supply of nutrients, nutrition, nutrition to the tissue, that can cause the necrosis of the tissue and can cause the ulcers. Then coming to the next one, shearing force. Shearing force means if the patient is on the bed in slow position, they can easily slide on the bed. That time the patient's skin become fold, that can may cause pressure ulcer. Okay, skin can easily damage by folding on the one by one skin, like skin become fold, that can cause the pressure ulcer. Okay, sliding. These all are the risk factors of pressure ulcer. Then coming to the options, immobility. Yes, in question they asked not the risk factor. Okay, here immobility is the can increase the risk. Then incontinence also increase the risk of pressure ulcer. Then poor nutrition also can increase the risk of pressure ulcer. Then coming to the last option, they have given hypertension. Hypertension can cause, but it's very less. In hypertension, no, not that much perfusion, low perfusion is there, so this is not the correct answer. So our correct answer of this question is D, hypertension not cause the pressure ulcer. Then move on to the next question, segregation of biomedical waste should be done at. Again on the biomedical waste management, if the in your hospital already we have to segregate the all wastes, how we have to segregate, then when we have to segregate the generated waste. See, we have to know about the meaning of segregation. After that only we will answer this question. Segregation, what is this segregation? This is the separation of generated waste. Separation of generated waste. In hospital, waste when it will generate, where it will generate, most of the times the hospital waste is generated at the bedside only. How I will explain, if the patient, if you are doing the dressing to the patient, there is a generation of waste like dressing, soil dressing also. Okay, swabs are there, and gloves we will use while doing the dressing, and syringes. Okay, sometimes you will use the blades also, scalpel blades. So now this much waste is generated at the bedside. how you will discard these? You will discard these two dressing and the swabs you have to discard in the yellow color, and gloves and syringes we will discard in the red color, then scalpels we will discard in the white. So this is called as a segregation. You will discard it in the particular color coding. This is called as a segregation, where these all process it happens in the bedside. So this is called as a point of generation. This is called as a point of generation. Then coming to the question, segregation of biomedical waste should be done at. Now you can easily answer this question. Central storage, no. After segregation, we have to collect the whole hospital waste, and we have to collect in the particular place in the hospital. That one central storage. This is not the answer. Treatment site, treatment will be processed in last stage after taking the whole hospital waste to out of the hospital area, and after that we have to treatment. So this is also the not answer. Then common collection point, no, this is also the not answer. The answer of this question is C. C answer is the correct. Then move on to the next question. The main purpose of surgical hand washing is to. So here again question on the hand hygiene. Hand hygiene. Then coming to the options, remove the visible dirt only, eliminate all microorganisms from the skin, reduce the transient and resident flora on the hands before surgery, and soften the skin before wearing the gloves. See, let us discuss the one by one options. Option A, removing the visible dirt only. See, if you are doing the surgery, we have to do the surgical hand washing. So here, for visible dirt, we can do the medical hand washing also. Okay, medical hand washing. So we can do the medical hand washing, and again next, eliminate all microorganisms from the skin. So this is not possible because some of the floras present in our body, in our hands, it can't go anywhere. If we do anything means also it won't go. So this is the not possible. Then coming to the option D, soften the skin before wearing gloves. There is no connection between the surgical hand washing. You can apply the moisturizer to the your skin to make the skin soften. So this is also the not answer. Then coming to the option C, reduce the, see here they have given reduce the transient and resident flora on the hand before surgery. What is this transient flora and resident flora? See here, transient flora means these are the bacteria which all are present on our hand, superficially present. Okay, these all are present in superficial layer of skin. Okay, then in resident, these all are the bacteria which all are normally present in our hand or skin. It won't go anywhere. So these all are in the deeper layer of the skin. Deep layer of skin. Then transient floras are temporary. Okay, it can be easily removed from the hands. These all are temporary. And residents are permanent. Then transient flora we can remove by medical hand washing also. Okay, but resident bacteria we can't remove, but we can reduce by surgical hand washing. Then these transient floras can cause cross infection. Okay, transient flora can cause the infection, pathogenesis. But resident flora or normal flora, it won't cause the no infection. Okay, no infection, no pathogenesis. These all are the difference between the transient and resident flora. Transient flora can cause, and resident flora, these are our normal bacteria which all are present in our hands and skin. So our correct answer of this question is C. Here they are already given reduce the transient and resident flora from the hand. So correct answer of this question is C. Then move on to the next question. Shelf life of whole blood stored in CPDA is. So there are so many anticoagulants are there, anticoagulants and additives for storage of blood. anticoagulants and additives. These are anticoagulants and additives which are used for the storage of the blood. It can increase the shelf life of the whole blood. Then first one CP2D, then second one CPDA. Here already given in the question. CPDA one solution. See what is this CPT2D? We have to store the blood up to 21 days by using this anticoagulant and additives. We can store up to 21 days in the CP2D. In CPDA we can store up to 35 days. Okay, by using this we can store up to 35 days. Then coming to the one by one discussion, what is this CPDA? What is this C means citrate and P means phosphate, D means dextrose, and coming to the A means adenine. What is this citrate? What is the function of this citrate in the blood storage? This citrate bind with calcium and prevent the coagulation. This is chelating agent. Okay, chelating agent. Then what is this phosphate? Phosphate, it will maintain the pH of the blood. Okay, pH buffer function. Okay, it acts as a buffer. It will maintain the pH of the blood. And dextrose for the metabolism. Okay, metabolism. Then adenine produces the energy. Okay, for ATP. This is a form of energy. Okay, so these all are the function of these additives. We have to remember this. Examiner can also ask the question from these things. Okay, so coming to the options, 7 days wrong. Correct answer of this question is D. D is the correct answer. Then 21 days we can use if we use the CP2D. Okay, move on to the next question. The storage temperature of platelets is, again on the blood products. Okay, there are so many products in the whole bloods. Products of bloods are PRBC, platelet, then next one fresh plasma, FFP, and cryoprecipitate. So PRBC we have to store in the 2 to 6 degrees Celsius temperature. Okay, this is temperature 2 to 6 degrees Celsius. We have to store up to 35 to 42 days. In the PRBC we have to store in the 2 to 6 degrees temperature and 35 to 42 days. Then coming to the platelets, we have to store in the room temperature 20 to 24 degrees Celsius. So up to 5 days we can store. Only 5 days we have to store. Within the 5 days we have to use, otherwise it will expire. Then coming to the FFP and cryoprecipitate, both we have to store in the minus 18 degrees Celsius in the freezer. Okay, freezer we have to store. We can store up to 1 year. So this is the chart we have to remember. In this table they can ask any of them. In the question they have asked the storage temperature of the platelets. So answer of this question is B. Correct answer is B. Then move on to the next question. The jet track method is used for which type of injection? What is this jet track method? Jet track method, why we have to give? And then what are the injection we can give in the jet track method? What are the sites of this jet track method? Jet track method is the modified intramuscular injection. Okay, IM injection. Then why we have to give this? We have to prevent the leakage. Prevent the leakage of the medicine into the subcutaneous tissue from the intramuscular. Okay, from muscle tissue we have to inject the medicine. It has to prevent the leakage of medicine into the subcutaneous or outer skin also. Then prevent the irritation, irritation and pain also. Okay, some injection can cause the very irritation and pain, so we have to use the jet track method to prevent the irritation and pain to the patient. Okay, then proper absorption also the point of this jet track method. So complete absorption also. Then how we have to give this? Okay, right. Then how we have to give this one? And see here, this is your outer skin, this is subcutaneous, here the your muscle is there. So first, this is the site of your injection. For example, this is the site. Before inserting the needle, we have to pull the skin parallel. One side we have to pull the skin. Now it become this. Then after that we have to inject the needle here. So we here point side, from this side we pull the skin from to here. Now we are injecting the needle here. Okay. So this is the site. It becomes the jut like. Okay. After removing the needle, again we have to release the skin which one we have pulled. This is the jet track method. So it can cause prevent the leakage of medication into the subcutaneous tissue. Then what all are the injections we have to give in the jet track methods? That one example, iron dextran. Then one more important, haloperidol, HPD. Most important injections which all are already asked in the previous examination. How we have to give the haloperidol injection to the patient? That one, IM jet track method. Okay. Then move to the next question. Okay, this is our today's session. I will come with a new concept, a new MCQ series. Then follow the Agni Nursing Academy and download the Agni Nursing Academy from the Play Store, and you can attend the tests. So many tests are free also there. You can improve your skill through the test also. Okay, thank you.